Hey, welcome back to The Practical Pregnancy, where our mission is to give you fear-free information so you can move through your pregnancy with confidence and peace no matter what. I'm Tamara. I'm full-time midwife, full scope primary care midwife here in Canada, and so glad you joined me today. Today, we're going to talk about nausea and vomiting. Yes, it's a real thing. As many of you have gone through, many you've heard about, it can be nasty. It's usually the worst in your first trimester. That's from the time of conception to the 12-week mark in pregnancy. And for some women, it actually gets better after the 12-week mark. And for many people, it goes away completely. And unfortunately, there's the other group where it lasts for the entire pregnancy. It's largely hormone driven, nothing you can do about your hormones, and everybody responds differently to being pregnant. So if you are one of the people experiencing extreme nausea and vomiting, my heart goes out to you. I was one of them too. I know it's not nice and it's not fun. So there are some things you can do to try and help yourself feel better in those times. Really important to think about hydration. Number one, you want to make sure you're staying hydrated. Even if you're feeling like you can't really eat much, or foods like the smell of certain things, the texture of certain foods, the thought of eating certain foods is like just making your stomach churn. It's really important to stay hydrated. And some tips for staying hydrated when you can't even tolerate just water is to add lemon to your water. It'll give you a really good boost of vitamin C. If you think you can tolerate it, you can boil up some ginger in water. Ginger is well known as an anti-nauseant. And if you boil up the ginger in the water and then add some lemon juice to it, you can have it hot or cold. That can be really helpful for helping with that extreme nausea. Now, other things you can do is you can take vitamin B6. It is one of the active components of a medication called diclectin, which you may have heard about, your friends may have told you about, maybe you've even taken it yourself. It's kind of like the first line medication given to women who are really struggling and not doing well with nausea and vomiting in pregnancy. It's one of the mainline medications. So the active component, one of the active components in diclectin is vitamin B6 or pyridoxine. And if you don't want to take medication per se, you're hoping to limit the synthetic or man-made products that you're ingesting while you're pregnant, you could think about taking a vitamin B6 supplement. Sometimes people find that's enough to help them manage with their nausea and make it tolerable for them. Now, often it's called morning sickness. Many people do feel worse in the morning, but unfortunately, it can, for some people, be an all times of the day sickness. Some people even find that it's worse at night. So regardless of how you're experiencing it, just know that it's normal. It's not something you're doing wrong per se. And you basically have to just try what you can, natural remedies, or if you do decide it's severe enough that you need medication, to talk to your care provider about that, whether it's your family physician, your OB, or your midwife, because they can help you navigate which medication or which supplement or even which natural remedy might be helpful to you. Some other things to think about are eating small, frequent meals. Sometimes just keeping your blood sugar stable and keeping it level can really help with dealing with those extreme feelings of nausea or vomiting. Eating things that are high in protein can also help. So that's another little tip that you can try. And like I've already mentioned, I can't stress enough, staying well hydrated. Now, for those of you who have extreme cases, you might have heard of people or even yourself may have experienced something called hyperemesis. It's basically where you can't keep anything down. And if that's the case, where you're vomiting and you can't stop and you're starting to feel weak and very unwell, you need to seek medical attention right away. And I encourage you to do that. Don't tough it out. Don't be a martyr. Go seek help, because we want you and your baby to be at your best. And it's just part of pregnancy for many women. And it sucks, frankly. It's really nasty. But hopefully you can try a few of these tips and hopefully they help you and help you in your journey of dealing with nausea and vomiting in pregnancy. Don't forget to hit that like button and subscribe for more content. We want to keep it coming your way, and hopefully you're finding it helpful. And until then, be confident, be filled with joy, be at peace.